Hello, everybody. My name is Nishi Singhal. I'm the program officer with the Texas Primary Care Consortium, and welcome to this month's Monthly Monday Primary Care Talks. We are dedicated to interviewing guest speakers from across Texas, covering a wide range of primary care topics. And each month, we are bringing you informative episodes as your go-to resource on all things primary care. So today we get to hear from Kelenne Blake. She is a health advocate, creative, and Black academic from Trinidad and Tobago, who's now based in Austin, Texas. She's been involved with Black Mamas Community Collective, aka Black Mamas ATX, in various roles since 2018, but now serves as the executive director. As a creative, Kelenne does visual, performance art, as well as writing, poetry, and screenwriting. She also considers herself a Black academic. Kelenne is a former professor and is now a current doctoral student at the at the Johns Hopkins University in public health, concentrating in health equity and social justice. Living in the intersections as a Black immigrant woman, everything she does involves working creatively with vulnerable communities, disrupting false hierarchies, and creating spaces for those communities to assert their unique voices, perspectives, and power. And in doing so, she is creating a better world. Let's go to the show. Thank you so much for joining us today. I'm very excited to learn more about you. So, if you could tell us a little bit more about yourself and even how your work impacts our primary care system here in Texas.
Sure thing. My name is Kelenne Blake. I am the executive director at Black Mamas ATX, which is a nonprofit organization that serves Central Texas to address the maternal health disparities experienced in the Black community. How we operate is very community-based. We provide no-cost doula support for anyone who is Black and pregnant in the five-county Austin metro area. So that's Texas, Central Texas area. Additionally, we provide free mental health support for our doula clients, since one of the biggest complications of pregnancy can be postpartum depression. And also there's a lot of mental health needs during and around pregnancy. And it has a big impact. So those are our two biggest areas that we're known for in the service we do. But we also build community and encourage, healthy living, healthy movement, provide education, and work towards structural change, whether that is participating at a rally at the Capitol or uh, educating the public about what needs to change and what is working and what good moves are happening as well. So that's a little bit about me. Uh, in terms of the Texas Primary Care Consortium. I was honored to be able to speak last year at the TPCC conference, and that was my first major introduction to the consortium. And I've since talked with other folks and gotten some really great feedback, and um, I really I really appreciate your work and primary care in general. It's actually that experience gave me a much better understanding of where primary care fits in with the work I do. I particularly like to point out family medicine and internal medicine, the doctors who are the ones we go to for our, say, annual checkups, if we're able to go to our annual checkups. I like to remind folks that family doctors can do a little bit of everything. And so if you are pregnant, they are especially if it's someone you trust, um, primary care physicians are a really good place to get some of your prenatal care, to get some of that um, medical support from someone you trust because you've been going to them before and they know you and you know them. So a lot of the concerns and a lot of the fears around, the disparities that people face is that they end up with doctors who have implicit bias, who they don't know and they don't trust and who don't listen to them. And that, at least in some of the prenatal and postpartum care, your primary care doctor, who you do know and you do trust and who does listen to you, could be one of the ultimate advocates for you and one of the key people in your care team. And people forget that because once you think pregnancy, you think OB or midwife, and there's no reason to not include your primary care physician in that perinatal period. And there's many reasons to include them.
Yeah, I really appreciate that comment and that insight. I was actually just having a conversation with Ankit before this that, it's like, for example, HB12, it's amazing, right? Because it really helps with that postpartum care, which we know we is really um in Texas especially, right? Like with the high maternal mortality rate, that was required that we had to expand that, and that's amazing. But also, what about prior to getting pregnant, right? We know that the healthier a mom is, the healthier the healthier the woman is, the healthier their pregnancy will be, and then the healthier you will be afterwards as well. And
Mhm.
so with kind of, your insight that you're getting about primary care, I'm curious, like from your perspective, right? Because we were just talking about how our perspective is very much from that public health lens. How would you define primary care? Or how have you kind of seen primary care has assisted maybe in the work as women are getting access to doulas? And I'll actually kind of ask you another question along with that is what else do you need from primary care then too in your work, right? Like, do the doulas have good relationships with providers, or do you feel like that could be worked on a little bit more? So I guess just curious on your perspective.
When I think of primary care, I think of the family doctor, right? I think of the person who honestly knows how to do a little bit of everything, and you go to them for anything. But most of us in the US, not everyone has a primary care physician. Not everyone goes for their annual checkup. And I think that's a really important starting point. I also have worked a lot, talked with a lot of internal medicine residents who often get into primary care. Um, and it's just, yeah, I am, as I learn more about primary care, I see its importance and its potential, but I'm also learning that fewer and fewer doctors are getting into primary care and more of them are specializing and hyper specializing. Uh, the the what I want to encourage is for more um, more primary care physicians to make it clear that, you know what, if you are pregnant, you can come here to um, get that first, declaration that you are actually pregnant from a doctor, because apparently you need that for a lot of things, even though it's the same process basically of finding out you're pregnant. But you can come here to get your initial prenatals. We can refer you to an MFM, a maternal fetal medicine doctor, if needed. They're the same doctors that the OBs are going to refer you to anyway. The same doctors that a midwife might refer you to if you need further information. And so making it a little clearer to families that primary care is there for all the transition, all the health related and body related experiences in life so that people don't feel so limited because there are not that many OBs, and then there are even less Black and brown OBs. Um, and the OB is not the person people tend to typically go to for their annual wellness checkups, So they're not going to be as trusted, and they don't know you and you don't know them as well. So there's some ways that I wish primary care physicians can just communicate more, tell the story more. We're able to help you too, especially if you're having trouble finding um, more specialized care. We can still guide that medical aspect of your journey. I also want to see primary care doctors work hand in hand really well with midwives and community-based midwives, because a lot of folks are because of the maternal health crisis, finding, trying to find midwifery care rather than hospital births or hospital care. And in that case, again, the midwife would still team up, likely send you to a maternal fetal medicine doctor still, if um if they need to get some extra information that they're not able to get. I really would love to see more primary care doctors in that team, the community-based team of like midwives and doulas supporting a birth. What I have a little story, what we have experienced and how we have seen, um, at least a primary care doctor really helped one of our moms in her postpartum experience. She had a very traumatic birth experience at the hospital. Um, she was taken, she was induced, but what often happens is that the induction is really, one, unnecessary, but two, not given enough time to go through its full process. And it leads to intervention number one, intervention number two, emergency C-section, right? Um, and so that was her experience. But the emergency C-section uh, damaged damaged a nerve or a plexus, some nerves for her, and she's now permanently disabled. She, at the time, she couldn't feel her legs. She told them this issue. There was time for them to fix it, but they didn't listen. Um, and she still to this day cannot get full information from the hospital. There's notes missing from her information. Um, and the only way she was able to get a final diagnosis and get an honest medical opinion that, yes, this is a permanent disability that you now have, was through her primary care doctor. She had to just go back to her primary care doctor, and that's the person who got her connected to physical therapy. That's the person who got her connected to a specialist who was able to figure out what was damaged and how that's going to impact her for the rest of her life. To this day, the hospital is there just for a moment, and beyond that moment, they're not particularly helpful. And what
Yeah.
happens in that moment is just, it could go so many ways, but the primary doctor is there before and after. And, we know if we can encourage more people to build more relationships with primary care um, physicians, I think that gives them even a extra layer of support to handle the other things that they do experience potentially during pregnancy and childbirth.
That's so sad. And it's so I'm currently pregnant right now, and something that my doctor just shared with me is my OB shared with me is that, during the labor I will they have to give me antibiotics for like something. And I made sure to tell my husband that too, right? Like I now know that information. My doctor, of course, knows, but I also wanted to tell my husband because he will, of course, be there. because of what you're alluding to, the lack of consistent communication. And I think what you're basically saying is that what a primary care clinician could fill the gap in is to be almost that like that project manager, right? To kind of ensure that, all things need to be communicated to all parties, including the patient, right? Like especially the patient. And having that coordinating person or body of people, right? Like what we call a care team, to really be on the patient side, like really be patient centered and maintain like the best person-centered care that you can. And if there isn't that one agent that you have that's kind of by your side, I think that story just kind of pinpoints to what can fall through the cracks, unfortunately, right? And unfortunately lead to these negative outcomes.
Yeah, absolutely. And there, the perinatal experience is long, right? And so there's so much there's before pregnancy, but there's also the entire pregnancy, where, you know, you just really want to build the right team. We provide doulas. Doulas are part of that team. And so the doulas assist in that, you know, ensuring patient-centered care, helping the client or the patient advocate for themselves, preparing them for the birth, preparing them for the postpartum period, translating the medical jargon that might be, you know, mentioned to them in the middle of, labor, helping them to find more comfortable ways to labor and understand the options given to them or the options that they have, whether or not presented to them. And so that's where we specialize, as a community-based organization. But doulas are not healthcare providers, right? And so there is there is some of that work that could be held by, say, a primary care physician. And then in the postpartum, a lot more of that work could be held, just because a lot of the concerns and complications do come afterwards. And it would take, if they don't have a doula in postpartum, our doulas stick with our moms for a year postpartum. But if someone does not have a doula to talk to and does not check in, and or if they're not used to speaking about mental health, then postpartum depression could set in, and there may not be anyone to help guide them and get them to mental health support. But if they're having regular check-ins with their primary care physician, if they're having discussions with the right people who make up their team and who know to look out for signs of depression, or who know to look out for signs of, you know, things that especially are prevalent in the Black community, preeclampsia. It's been happening so much. Um, so that headache, someone can tell you it's not just a headache, you know. Someone could encourage you or teach you. Technically, the doulas aren't really able to teach you how to take your blood pressure, but someone can. Primary care physician could, and tell you what to look out for. So yeah, there's a lot of ways that our work all that we can all work together to ensure that pregnant and birthing folks do have a safe experience. And even with the imperfect medical system and the imperfect, maybe hospital care system that some people might encounter, some hospitals are great, some are not. We know this. And so this care that outside of that bubble is much longer and much deeper and could be much more impactful.
Yeah, that makes so much sense. And actually curious on because you mentioned that the doulas work with the patients or work with the women for a year postpartum, which is amazing. Um, how I know HB12 is kind of being implemented now, but curious on how do you think that's gonna enhance or maybe change the work that's happening through your organization right now?
It may not change or enhance directly, since in Texas, doulas are not considered Medicaid providers and are not able to receive insurance, receive compensation from Medicaid for the work they actually do. There is a bit of a step towards that, in that doulas were mentioned in a bill, HB 1575, that was written for community health workers and resource navigation,
Yeah.
which that's not what doulas do.
Mhm.
So, giving them the opportunity to bill for something they don't do, it makes it a little complicated. And we're trying to figure that out. But, there's no saying doulas may not even sign up as Medicaid providers, because that's not what doulas do, right? Um, but how it could help is that, you know, a doula would know, say if someone is on Medicaid, the doula would know that they can, more confidently suggest they go to their doctor,
Yeah.
um, even if it's months after, and the person's experiencing something and they have questions. Because it does take a long time to recover in the postpartum for some people, and some people do experience complications that last a very long time. And then for someone who experienced, like, the young lady I mentioned who experienced a permanent injury, she's going to need permanent care. Um, but if she were on Medicaid and that was all, she would at least get a year of care, and then have that year to figure out what she'll transition to afterwards. So it is a move in the right direction. Um, doesn't quite affect us as a doula organization, but it supports our clients a lot more, and gives us, at least if we know it, we can make sure our clients know it.
That makes sense. And that's what I was curious about because yeah, like if there's an overlap between some of the clients, in the organization who will now have that Medicaid coverage post, maybe there could be some sort of relationship that's built between the doula and then that new Medicaid primary care provider. So it'll be
Yeah.
interesting to see how things, yeah, operationalize and really unfold.
Yes.
Um, I I can't believe, we're already kind of to this last question because I could listen to you for much longer, but I wanted to end a little bit more on a positive note, which is, just that what would you love to see as, maybe one tactical change that could occur within our healthcare system, within our public health system to really help, enhance the work that you are engaged in. So the typical way I ask this question is, if you had a magic wand and you had one wish, what would that one wish be?
Hmm. I can answer that. I like magic. So I would say my one wish is that there would be more Black and brown primary care physicians who are well equipped to support Black and brown communities, and have the right lens, public health lens, anti-racism lens, equity lens, um, to have an impact. People go to who they trust, and um, there's aspects of culture and just belonging that a lot of people just don't get to experience as much when they interact with the medical system and healthcare providers. So magic one, more Black physicians at every level, but at the primary care level, um, at the and in perinatal healthcare specifically, with those specialties, but primary care level too, because we want kids, the whole families who go to family physicians to see someone who looks like them, who treats them with what I would what would remind me of how my mom or grandmother or uncle or father, like the same kind of things they might see, but in a healthcare setting, the same kind of care they would give you, but in a healthcare setting. I want to see that.
I love that. And I mean, there's just so much more research out there too that shows, is showing that within different demographics, there are just different health issues, right? Or different concerns or different even ways of treatment too. And
Mhm.
I mean, I love that both from a cultural lens of just as you're saying, like there's also probably more comfort sometimes as well.
Mhm.
Common language is also very helpful, but I mean, there could just be, specific issues that we're kind of missing out on or specific ways of, treating an issue too. So yeah, I really appreciate that.
Thank you. I really appreciate the question.
Thank you. Yeah, I had come up with it because I had started rereading Harry Potter, and so I was thinking in a very like magical lens, and
I love it.
it's fun to think dream state, I think, right? And kind of
Mhm.
be a little bit more impractical, and then you can dive into the practicality of like, okay, how are we going to implement this? So
Exactly. That's exactly it. You can't, the first step to change is imagining what you want, what change needs to happen, imagining a different world, and then you try to get there.
agreed.
Yeah.
Agreed. Thank you, Kelenne, for your amazing perspective on our primary care system here in Texas. It was such a fun conversation, and I totally lost track of time. And so, as an audience, if you all want to reach out to her and connect with her and to learn more about her, you may do so by emailing her directly. If you have any feedback for us, we'd love to hear from you. If you even have ideas for guest speakers, especially as we go into the 2025 new year, we would also love to collect those from you. This has been the Texas Primary Care Consortium's monthly Monday Primary Care Talks.